Welcome. Today we're delving into a condition affecting the urinary system called ureterocele. We'll explore what it is, how it develops, and what can be done about it. Join us as we unravel the complexities of this unique medical condition. The exact cause of ureterocele isn't always clear, but it's believed to be a congenital condition. This means it's present at birth. It arises during fetal development when the ureter, the tube that carries urine from the kidney to the bladder, doesn't fully develop properly. Instead of seamlessly connecting to the bladder, a narrowed or balloon-like swelling forms at the ureteral opening inside the bladder. Genetic factors and other unknown developmental anomalies might also play a role in its formation. Okay, let's understand the mechanics of ureterocele. The ureterocele, this balloon-like swelling in the bladder, can obstruct the flow of urine. This obstruction can lead to several problems. First, it can cause urine to back up into the kidney, leading to hydronephrosis, which is swelling of the kidney due to retained urine. The ureterocele can also interfere with the normal emptying of the bladder, leading to urinary stasis or incomplete voiding. This stasis can increase the risk of urinary tract infections, or UTIs. In some cases, the ureterocele can protrude outside the urethra, particularly in females, causing further complications. Ureteroceles are relatively uncommon. They occur in approximately 1 in 4,000 births. While they can occur in both sexes, they are 4 to 7 times more common in females. They are also more frequently found associated with duplicated collecting systems, meaning a single kidney has 2 ureters draining into the bladder. The signs and symptoms of a ureterocele can vary depending on its size and location, as well as the degree of obstruction it causes. Some individuals, especially with small ureteroceles, may have no symptoms at all. In others, the symptoms can include frequent urinary tract infections, abdominal or flank pain, blood in the urine, also known as hematuria, difficulty urinating, or a weak urinary stream. In severe cases, especially in infants, a ureterocele can cause failure to thrive or even kidney damage. In females, a protruding ureterocele may be visible as a small mass in the vaginal area. Diagnosing a ureterocele typically involves a combination of imaging studies. An ultrasound is often the first test performed, as it's non-invasive and can visualize the kidneys and bladder. A voiding cystoscopy, or VCUG, is another important test. This involves inserting a catheter into the bladder and filling it with contrast dye while taking X-rays as the patient urinates. This can show the shape of the bladder and urethra and identify any reflux of urine back into the ureters. A CT scan or MRI may also be used to provide more detailed images of the urinary tract. A cystoscopy, which involves inserting a thin, flexible tube with a camera into the bladder, can directly visualize the ureterocele and its location. Ureteroceles can be classified based on their location and complexity. One classification divides them into intravesical and extravesical. Intravesical ureteroceles are those contained entirely within the bladder. Extravesical ureteroceles, on the other hand, extend into the bladder, neck, or urethra. Another important distinction is between single and duplex systems. A single system refers to a kidney drained by one ureter. A duplex system is when a kidney has 2 ureters draining into the bladder. Ureteroceles are more commonly associated with duplex systems. Treatment for ureterocele depends on the severity of the condition, the presence of symptoms, and the age of the patient. In some mild cases with minimal symptoms, observation may be sufficient, with regular monitoring to ensure no complications develop. However, most ureteroceles require intervention. Options include endoscopic incision, where a small incision is made in the ureterocele to allow urine to drain more freely. Surgical reconstruction may be necessary in more complex cases, particularly when significant obstruction or kidney damage is present. This may involve removing the ureterocele and reimplanting the ureter into the bladder, or other reconstructive procedures to improve urine flow. Antibiotics are often used to treat or prevent urinary tract infections. Unfortunately, because ureteroceles are congenital, there's no known way to prevent them. However, early detection and management can significantly reduce the risk of complications and improve outcomes. Prenatal ultrasounds can sometimes detect ureteroceles before birth, allowing for early planning and intervention after the baby is born. The prognosis for individuals with ureterocele is generally good, especially with early diagnosis and appropriate treatment. Most patients can expect to have normal kidney function and a reduced risk of urinary tract infections after intervention. Research continues to focus on improving minimally invasive surgical techniques and understanding the genetic factors that may contribute to the development of ureteroceles. Newer imaging techniques are also being explored to enhance diagnostic accuracy and guide treatment decisions.